Hi, everybody. This is Lisa Hurley. Welcome. Thanks for joining us. Introduction into Peptides. I'm Lisa Hurley. I'm nurse practitioner here at Fulcrum Aesthetics and very interested in wellness, peptides, hormone therapy, weight loss, but so many questions about peptides. There's just so much information out there, very confusing. So I wanted to start this off with a general introduction. And then later on, we're going to start slowly going through different classifications because we can only just hit the tip of the iceberg today. So, so let's start with just basic terminology. Peptides, what are they? They could be anything. Basically, they're just a short chain of amino acid. That's it. Typically under 50, but there's over 7,000 naturally occurring peptides in our bodies. We obviously, there's not that much offering out there, but there's a lot. They play a huge role in various biological functions. We couldn't exist without it, including acting as hormones, signaling molecules in our body, repair. It's amazing. So I'm going to start by just hitting some of the classifications because when you Google peptides, you just get barraged by all of this information. So these are just a couple. The ones that I'm putting down here are the ones that most people ask me about, and or I have more ability to access, and we'll talk more about that later. So metabolic and weight loss peptides, we can't go any further without talking about the big ones. Semaglutide, GLP-1, tirzepatide, which is GLP-1 plus a GIP, and we now have retatrutide, which is right around the corner. That is pending FDA approval. Anticipate that it will be on market possibly end of this year, but most likely next year, and probably more retailally available mid to late 2027. So potential uses. These medications initially were used for diabetes type 2, then they realized the huge weight loss potential, and we just started going down that path. We now understand that they have a much bigger impact on our longevity, overall health, cardiometabolic health. And I think that we need to acknowledge that these are not just weight loss medication. This is about longevity. This is about health moving forward. And I think there's going to be a lot of people that are on these medications lifelong as we, progress and find more benefits. Then there's cosmetic, dermatologic peptides. There are so many, but the most common ones that I'm asked about is the GHK-Cu copper peptide. Now you can access this topical. It's very well known to help with skin repair, collagen production. Also helps hair growth support, fine lines, wrinkles. We can get it also in a compounded cream that includes estradiol, estrogen, topically, that really accelerates the properties to help minimize fine lines, wrinkles, firm up skin. Mitochondrial and longevity peptides. Most of these peptides have overlapping uses, and we could add a lot more into this category. And when in future masterclass, we will break these down. But right now, we'll just talk about some of the most common: NAD, and of course, GLP, GIP. Once again, metabolic health, healthy aging, that there's huge research on that right now, exercise performance. We're going to talk about the growth hormone secretagogues, GHS. Two most common, sermorelin, tesmorelin. Potential uses, common uses, overall recovery, exercise recovery, body composition improvement, muscle preservation, healthy aging research. We'll talk more about this, especially the tesmorelin, because it's fascinating peptide. So sermorelin later on. Tissue repair and regenerative peptides. Big, big, big interest in BPC 157, TB 500. And of course, we've got to add the GLP-1, GIP combination because they fit in this category as well. Potential uses: tendon repair, ligamental injury, soft tissue, swelling, gastrointestinal repair. Now, there are huge variations in the research, and many remain investigational. In fact, the BPC 157, the TB 500, while previously accessible through compounding pharmacies, got placed in the category 2 by the FDA. Although that looks like that's going to be reversed end of next month. So we're going to be watching that. That may be more accessible moving forward. Immune modulating peptides. Now, these influence immune function, inflammation. That's once again BPC 157, thymosin alpha 1, LL37 on the category 2 list right now. So that's something we're kind of watching. But once again, potential uses immune support, chronic infection, and there's a lot of research regarding inflammatory conditions surrounding these peptides. Neuroregulatory and cognitive peptides. Fascinating stuff. Cmax, both unfortunately are kind of circling around the category 2, but should be moved to the category 1. Like I said, end of next month is what it looks like. Potential uses, improve cognitive performance. We're talking about, ALS, Parkinson's, strokes, anxiety reduction. Neuroprotective research is ongoing currently. Then sexual wellness. There's a real fascinating one, PT-141, bromelitide. It is under the brand name Vyleesi. It's FDA approved. That's specifically FDA approved for women in a particular disorder, hypoactive sexual disorder in women. But it is also effective in men. This can be used either nasal spray or injectable. And what's interesting is it utilizes a different pathway. You think about Viagra, that has a lot of cardiovascular implications. This does not. It goes down a completely different pathway. So if you have underlying, hypertension or cardiovascular disease, doesn't mean you can't utilize this medication. So, once again, I just want to really impart that there's so many multiple crossovers on these peptides. You can utilize them for different things that you're trying to achieve on your own wellness journey. So we're going to go into the most popular peptides: tirzepatide, semaglutide, retatrutide, BPC 157, glutathione, and NAD. So semaglutide, one that's been around, the longest, right? It was first approved for diabetes type 2, FDA approved. It still is when they started realizing the huge weight loss potential. So it's FDA approved for that as well. There are some oral versions, Rybelsus, it's FDA approved, and the new Fondejo. One of the big differences is that the Fondejo, you don't need to take it with food. You can take it on an empty stomach. Those are both daily. I just want to make a few comments about the oral medications. They are, in my opinion, at this point, for a particular subgroup. That would be for people who have already achieved weight loss and they're on a maintenance, point, or if they're just looking for longevity rather than weight loss, or they're really needle phobic, you could trial this as well. The injectable just appears at this point to be more effective if you're looking at just weight loss. Tirzepatide is a GLP-1 plus a GIP. Once again, FDA approved both diabetes type 2 and for weight loss under different names. So like the semaglutide brand name would be, Ozempic or Wegovy, depending upon what you're using it for. And it's the same medication, but different dosing. Still every 7 days. Tirzepatide, same thing. FDA approved for both weight loss, diabetes type 2, so it's Zepbound for weight loss, Mounjaro for diabetes type 2. Now, if you look, what the research shows is that semaglutide, you can lose approximately 15% of your current weight. That's kind of what during the study was the average. That's not necessarily true. I've seen plenty of patients that's lost significant amount of weight on semaglutide. Tirzepatide, they estimate up to 20.9% weight loss. Once again, I've seen that higher numbers in individuals who are very motivated and do everything in their power to work with this medication. Obviously lifestyle modification is one of it, but ensuring that you're really eating clean, high protein, water, fiber, that can really help to protect your muscle and focus more on just fat loss. Now, retatrutide, that is not yet FDA approved. This is the big one everybody's waiting on. You can get it on gray market. I wouldn't do it. I would wait until it's FDA approved. They just completed the Triumph studies, and this is supposed to be 28.3% weight reduction. So that's a big deal. It's a combination, triple threat. GLP-1 plus GIP plus glucagon. It does increase metabolism as well. So this one should be approved the end of this year, beginning of 2027, although I don't think it's going to be really heavy into the market until mid 27, maybe end. But I don't know. I mean, everybody might be just gearing and ready to go. We'll find out. GHKCU, copper peptide, love that. This is really awesome for collagen support, regenerative skin, hair treatments, anti-aging, healing, as well as tissue remodeling. This, once again, you can get this in topical formula, you can get this in injectable. It is not FDA approved in injectable. There is talk that they're looking at the topical products possibly being FDA approved. You can get this through compounding pharmacies. One of my favorite combinations is the GHKCU with estrogen. It also has hyaluronic acid. We get it through compounding pharmacy, and you can see significant results. Glutathione. This is a really powerful antioxidant made up of amino acids, plays a role in mitochondrial function, DNA production, overall cellular health. Once again, not FDA approved. This is injectable. NAD. NAD in all our cells. It fuels our essential biological processes, cellular repair, cellular energy production. You can take this injectable. They do have oral formulations, or some combination you can use, but it's very common. It should be part of your regimen, your wellness regimen, in my opinion. Let's talk about BPC 157. This was really complicated topic. It is a great peptide. It really is. It is very helpful in tissue repair. I've seen a lot of surgical cases that like to do BPC 157, sometimes combined with the TB 500, just for tissue repair. Reduces inflammation. It stimulates growth factors. It also, BPC 157 has a really interesting property in the oral form. It's very protective of stomach lining, and they are studying it for leaky gut syndrome. And anybody who has any type of an inflammatory bowel disease should trial this. Whether it's just IBS or Crohn's disease, it's well worth a try. Sermorelin and tesmorelin are both in the same kind of class of growth hormones. Sermorelin's easier to access through compounding pharmacy right now, stimulates your body's own production of growth hormone, obviously stimulated pituitary gland, not FDA approved, but it can do multiple things for overall repair, including recovery, workout recovery, muscle growth, but well known to help with sleep and that regenerative period. If you don't get into the REM cycle, your body is not going to repair. Tesmorelin, fascinating in that this was FDA approved under the brand name Agrifta. This was specifically designed for a subpopulation, HIV patients who developed a really interesting issue, lipodystrophy, and it was basically subcutaneous fat in the abdomen. Really, just this group. So this drug was developed, it was very effective, but as we became more nuanced and effective at controlling HIV from developing to AIDS and the side effects, it's not utilized, and they let the FDA approval drop because it's not that popular. Now, I had been able to get this through compounding pharmacies, but I don't think there was a big demand. I'm having a hard time finding it there. You can get it through retail pharmacies, but it is extremely pricey. TB 500, once again, currently that's flirting on the category 2. We're thinking it's going to go to category 1. It is a synthetic fraction of a protein, thymosin beta 4, which is also a fairly hot topic right now. Improves cell migration specifically to injured cells, speeds healing, soft tissue repair, including tendons, ligaments, muscle repair, and can reduce scar tissue formation. That's why it was utilized in combination with the BPC 157, specifically in people, post-surgical. Of course, not FDA approved. We're still, I don't know that it will. Uh, Selink, C-Max, first of all, these are nasal sprays right now. So what's interesting is it further enhances insulin secretion, helping to reduce appetite. 20.9% weight loss on Selink. I'm sorry, this one is FDA approved for weight loss and diabetes. Nope, sorry, got an error there. Ignore that. I will correct that. All right, back on track. CMAX, same thing. It's really important in overall repair. This is more neuroprotective, a really unclear mechanism. This is the one that's used ALS, Alzheimer's, ADHD, after stroke, cognitive function, anxiety. It is intranasal, so it's pretty easy to use. You use it daily. The C-Link, it was actually synthetic regulatory peptide that was developed in Russia at the Russian Institute of Molecular Genetics for its anxiolytic properties and antidepressive. They kind of compared it to a benzodiazepine without the addiction properties. I don't know if I believe that. I would say, of course, it does have the potential, but it might be worth a try, especially in the nasal spray. And that's pretty easy. We can get this through our compounding pharmacies currently. All right, we're going to go into sexual wellness. So there's a particular peptide PT-141. It is FDA approved. It's under the brand name Vyleesi. It specifically is for hypoactive sexual desire disorder in women. This is injectable or intranasal spray. It also works in men. And like I said, very interesting. It does not affect the vascular system, works via nervous system, and it's very interesting. It is a medication that you would take prior to intercourse, about 40 minutes before. You would want to try it ahead of time because it can cause some nausea in some sensitive people, and you could only utilize it 3 times a week. Of course, we still would have to do screening to make sure that you were, appropriate. I don't think that we can go further talking about peptides until we kind of talk about the political things going on behind the scenes. Because what I hear most of all is I see all these peptides, they're everywhere on social media, but I don't know how to get them. So we get cold calls all the time. Hey, can I get XYZ? And it's like, no, because they're on the gray market right now. So FDA classifications, and this is, RFK Jr., Secretary of Health and Services, Category 1, Category 2. So Category 1 means that compounding pharmacies can legally prepare. Now, compounding pharmacies are regulated 503A, 503B. Basically, that means 503A is patient specific. So if I write a prescription for you as an individual, it's going to come with your name on it with directions. That's 503A delivered directly to you. 503B is bulk. So that used to be, like tirzepatide prior to, the things that happened last year. You could get it bulk and then, distribute it to patients accordingly. Um, the thing about retail pharmacy and compounding pharmacies is that the majority of them are controlled through the individual state pharmacy, committee. That's generally where their license is. FDA plays a role, however, in 503B, the bulk. They generally are involved in at least inspecting the site where they're manufactured. So you know that, it's they have a system in place. They also have certificates they show it's pharmaceutical grade and certificates of analysis, which are very important. That's what we look for when we are researching compounding pharmacies for our patients. We want to make sure that that is in place. So we feel a certain level of trust. Category 2. So a lot of peptides got moved to the category 2 due to safety concerns, misuse, or what I find kind of scary is the proximity to existing FDA approved drug categories. So that means if there is a drug out there that the FDA has already approved that a drug company is making money on, and someone comes up with something that maybe does the same thing, yeah, they may never get approved because of that. So we need to be aware of that. And that's kind of how we look at it. Um, one of the things I want to mention is, like I said, the BPC 157 got moved to category 2. And then I think it was early this year when they announced that no, it should be moved over to category 1, and we'll do that in about 7 days. Well, we're still waiting. But the FDA is convening with Pharmacy Compounding Advisory Committee next month, July 23, 24, to discuss declassifying these particular peptides that I've listed, BPC 157, TB 500, MSC, to a category 1. I anticipate then it's going to shortly thereafter be more readily available through reputable compounding pharmacies, so we can get back to trialing them, trying to address your individual health concerns or goals. So sourcing, I talked a little bit. I just wanted to kind of explain because it's confusing. Where do you get these drugs from? Retail pharmacy, what does that mean? Compounding pharmacy, what does that mean? Compounding pharmacies, retail pharmacies, once again, primarily regulated by the State Board of Pharmacy, especially 503A, that's patient specific. Heavily regulated by FDA and the State Board of Pharmacy for quality of their products, safety of operations, once again, especially if it's bulk or 503B. I want to, just say the FDA, they don't control what you can get up to a certain point. It controls which medications become commercially available. They do not develop drugs, nor do the FDA conduct clinical trials. Now, let's talk about gray market. Hear a lot about that. You can get online right now. You can look up all of these drugs. You can get them at a very low cost through what we call gray market. They're sold as experimental. So they're sold outside any regulated medical channels, typically research grade. And that means that it's not intended for human use at this time. Basically, it means the research has not been done on people, probably on animals. But not on humans, so we're really not sure. So I would avoid that, personally. That basically is, the introduction, the things that I want to tell you about peptides, the questions that I get that I'm answering. And like I said, I'm going to have to continue on and then break these down into classes because there is so much more to talk about. Questions, I'm here for you. If you want to book a wellness consultation with me, you scan this, you can get $150 off. Lisa Masterclass Peptides, or text to schedule. Also have my email down there. If you have, a specific question that I can answer, quickly, I don't mind. But if it's lengthy, you're going to have to come in. We're going to have to talk. These are very individualized medication, just like any medication that you're prescribed. You need to be evaluated. We need to understand what your goals are. What is it we're trying to solve? Would this be appropriate, or would a combination be appropriate, or a completely different medication? So I am going to flip over to questions. And well, I don't have a question yet. I guess I've been really good answering all the questions. Great job, Lisa. So one of the questions is, how long does it take to get these medications once ordered? That depends on where they're ordered from. We have multiple different compounding pharmacies that we use or retail pharmacies. Sometimes it's very difficult to get them through retail. Compounding pharmacies, though, depending on what it is, actually make it for you specifically once it's ordered, like the copper peptide estrogen facial cream. So, and it's got to be shipped refrigerated. So sometimes that can take, 2 weeks to get it. Some of the other ones you can get, much quicker, in a week. It all depends on where you live too and how it's shipped. How's it administered? Like I said, depends on the medication. Some of them are injectable, some of them are topical, some of them are intranasal. We have to look at how it's offered and what it is we're trying to solve, like the BPC 157, whether or not you want to do oral versus injectable. Injectables, is a different matter. Oh, what does an appointment look like? Do you draw blood or look at hormone levels? That's a great question. So, yes, in a consultation, I really like a baseline, labs. If you have labs recently, you can bring them with you, certainly. But typically, I like to include a hormone panel. I find again and again a lot of times, men too, but particularly women, once you go into perimenopause, menopause, you start having these symptoms and they can be very subtle. So I do like to get a basic look at the hormone profile. So we not only do a complete hormone panel, we're looking at your thyroid, your TSH, T3, T4, as well as the inflammatory, looking for Hashimoto's. I like a hemoglobin A1C, which looks at your 90-day glucose level, because anybody can have a good glucose on a fasting draw. But what have you really been looking like for the past 90 days? Would this suggest that you have some type of insulin resistance? And then we might need to talk about maybe one of the GLP, GIPs. Um, additionally, a complete blood count. We look at a metabolic profile as well, vitamin D, B12. And then if there is something specific we're looking for example, if you said I've had low iron in the past, I have heavy periods, then of course we're going to add that on and take a look at that. Or if you have autoimmune concerns, we may look at some autoimmune profiles. Now, if we're going into additional labs, there's an additional cost on top of what's included in a consultation, but we'll talk about that in real time. And typically, as far as what the appointment looks like, you come in, we talk, it depends on how complex your history is, how much symptoms you have, medications you're on currently, because we're going to have to talk about that, how they impact your health, right now, what your family history is. That was a good question. Okay, well, I think that's all the questions we've got. Thank you so much for joining. Like I said, this is such a huge topic, we're going to have to break them down. So I'll make it into more bite-sized pieces.